the state of Georgia, we have some challenges. We have one of the highest maternal death rates in the country. We also have very high infant death rates compared to other states across the country. We have a workforce that is aging, and a lot of our OB providers don't look like the members they serve or come from the communities that they serve. Over the past 2 decades, we've had about 40% of the labor and delivery units close. So access becomes a huge issue for our maternal members. We are doing some things to address that. In the state of Georgia, we have had Maternal Mortality Review Committee that was set up in 2014. And that is a committee of individuals representing different healthcare professions. And they're looking at the cases where women have died either during their pregnancy or up to a year after delivery. And by looking at those cases, they can tell, well, why did they die? What conditions were in place? What problems did they have to deal with that prevented them from having a successful pregnancy? We're able to look at that and say, is there something in here that could have been prevented? We also have a Georgia Perinatal Quality Collaborative, and that collaborative is working with hospitals and hospital systems to address maternity care in the hospitals as well as neonatal care in the hospitals. So a lot of different efforts are going on to try to improve the rates that we have in Georgia. At CareSource, one of the things that we have recently launched is our Mom and Baby Beginnings program. Through this program, our pregnant members get paired with a CareSource team, and that team includes a care manager and it includes a life service coach. And this is a team that can support that member. They can ask questions about physical health, about behavioral health, oral health, all of which are very important for that pregnancy, but also ask about safe and stable housing, if they need access to fresh fruits and vegetables, other nutritious items, if they need job placement, if they need transportation.
The American College of Obstetricians and Gynecologists now call the postpartum period the 4th trimester of pregnancy, and that is because it is that critical. Oftentimes there's a perception that once the baby is born and it goes home with the mom, everything's fine. That's a very critical stage, not only for the baby, but also for the mom. So we know that there are certain health conditions like preeclampsia that can actually manifest themselves after pregnancy is completed. So it's important to stay vigilant about your health, but not just your physical health, but also your mental health. We know that postpartum depression and anxiety are incredibly prevalent, and we want to encourage moms to seek care if they are finding themselves grappling with troublesome thoughts and feelings. We want to create a supportive environment where moms can seek help not just from professionals, but also from support groups, from other family members, from other areas in the community that can really wrap their arms around that mom and help her be the best mom she can for her baby. We know that breastfeeding is critically important, but it's not as easy as you may think. So moms need help to start and sustain breastfeeding. We want to see moms nurse as long as possible. Up to 2 years is the latest recommendation, but moms need tremendous support. They need accommodations at work. They need accommodations at home. All of these things are issues that are incredibly important in the postpartum period, and we need to make sure we recognize that.
As we talk about the postpartum period and the importance of that mom getting the care she needs throughout that period, it's important, she now has to think about the child as well, and it's important for that infant to get well baby checkups throughout their first year of life because, again, we have high infant mortality rates, so it's important that they're getting regular screenings. And those screenings include developmental screenings so that we can see if there's a problem or something to be concerned about. The earlier you can intervene, the better that chance for that baby as they grow up. That child needs support. It needs support from everyone in the family to help them grow and develop as they should. They need to be exposed to books and the opportunity to learn, and not that they're going to be reading by the age of 1, but exposure to language is so critical for the development of that child.
Obviously, we want every mom and baby to have the best outcome possible. But what we know is that here in the United States, we have some very serious health disparities. And what that means is that even in the same areas in the same conditions, we know that certain populations do not fare as well as other populations. We know that Black moms and Black babies have significantly poorer outcomes in pregnancy. We need to move beyond the status quo and implement special programs and special efforts to address what we believe drives these disparities. A lot of this has to do with representation. So Dr. Sukas mentioned earlier about providers not reflecting the communities that they serve. And because of that, there is oftentimes reluctance or miscommunication between the provider and the member. And that is one of the things that we want to address. There's also implicit bias, misconceptions, historical trauma, other things that really impact the engagement with the healthcare community by our members and the outcomes that they ultimately experience.